Celebrating more than 33 years of providing quality, comprehensive primary health care to the medically unserved and underserved, Weston Medical Centers has established itself as a powerful presence in our community. From the array of healthcare services it offers, adult medicine, pediatrics, OBGYN, and dental, and its disease management programs, cardiovascular, asthma, breast and cervical cancer, and behavioral health for children and seniors, to its support of national health campaigns, Weston Medical Centers exemplifies its motto to provide world-class health care near you. In 1975, originally named University Center Community Health Plan, Weston Medical Centers first opened its doors. Former U.S. Secretary of Health and Human Services, Dr. Louis Sullivan, served as the first board chair. Back then, the center was a small 12,000 square foot building with only 8 exam rooms, quietly located at 868 York Avenue in the historic West End.
We tried to cram every possible service that we could think of in that 12,000 square feet. It just didn't work. We had much more need in the target area than we were able to serve.
Its original mission was to provide health care services to the students of the largest conglomerate of historically black colleges and universities in the world, the Atlanta University Center. Eventually, idealism took a backseat to the realism that surfaced, acknowledging that the medical needs of the surrounding areas were far too great to leave unaddressed. The center then began serving the entire West End district in an effort to impact the physical and social ills plaguing the once thriving community. Later, through its award-winning public housing primary care program, the center extended its reach by establishing and operating sites in Bowen Homes, Herndon Homes, East Lake Meadows, Thomasville Heights, and University Homes, and the WEMC Health and Wellness Center at the Veranda College Town. Today, the center operates the WEMC Health and Wellness Center at the Atrium College Town, the WEMC Health and Wellness Center, Allen Road Mid-Rise, the Family Health Center at Cobb, located minutes from I-75 at North Marietta and Cobb Parkways, and the Family Health Center at Bolton Village, scheduled to open in spring 2010.
And I tell you, I found my home at Weston Medical Center, which is a community health center that treats everyone the same. And it's affordable medicine, and it is just, you know what? I'm surprised they pay me to do this, because I would do this if they didn't pay me. Don't tell them that, though. I love it, and I want to do this for the rest of my life because this is my calling.
For the past 31 years, Daisy L. Harris, president and CEO, has fought to ensure that the center continues to implement medical programs with an emphatic promise to provide quality health care and social service programs that address the needs of the uninsured and underinsured.
My vision for the organization was really quite simple. It was to create a quality place, quality health services for the people. I want everyone to know that West End Medical Center is a quality place to come, and it is a center of choice and not a center of last resort.
For more than 23 years, the present board chair, Dr. Marianne Chivers, who also served as the center's medical director, has worked side by side with Mrs. Harris to move the organization to where it is today. Mrs. Harris' commitment to serving the needs of others can best be described as passion that makes a difference. Under Mrs. Harris' leadership, West End Medical Centers, still located at 868 York Avenue, has grown from its humble beginnings to its current 41,000 square foot state-of-the-art health center facility. Built in 1999, the main center and corporate headquarters house the administrative offices, more than 41 exam rooms, an on-site pharmacy which provides convenient access to prescription services for patients facing transportation challenges, and an X-ray department, an unusual addition to the myriad of services offered at community health centers.
As a 50-year-old female who has numerous chronic illnesses and do not have a job, unable to work at this time, and no insurance, the Patient Assistance Program has been godsend into my life.
Over the past 33 years, West End Medical Centers has generated more than 1 million patient visits. In 2009 alone, the center treated 24,250 patients, generating 54,282 patient visits. In addition to providing clinical care, West End Medical maintains a health education department that focuses on preventive health and disease management. In 2009, WEMC was awarded a grant by Susan G. Komen for the Cure Atlanta affiliate to provide free mammogram and support services to women between the ages of 40 and 49.
I've been unemployed for the last year and a half, and I have not had a mammogram in that length of time. I was at a health fair at South DeKalb Mall and ran into some representatives from the West End Medical Center who referred me to come over here to be examined to see if I qualify for one of their programs, which I did. I encourage all women to get your yearly mammogram. It's very important.
Seeking to serve its ever-growing Latin American and Sub-Saharan African French-speaking populations, West End Medical Centers, through its Social Services Department, established a cultural diversity component in 2002. West End Medical employs Spanish and French-speaking translators, cultural brokers, and case managers who address everyday concerns such as transportation, daycare, and medical interpretation.
¿Tú tienes diabetes?
Soy diabético y presión alta.
Y presión alta también.
Sí.
West End Medical Center staff, many of whom have watched pediatric patients grow to become OBGYN and adult medicine patients who now return to the center with their children, provide an unparalleled sense of dedication to the patients they serve. It is the relationship they build with patients that is the foundation for the center's growth. From providing free medical screenings to more than 100 health fairs and events annually, to sponsoring its annual back-to-school immunization fun fest and 5K asthma awareness run walk, it is through its community-based relationships and partnerships that West End Medical Centers has established its reputation as a healthcare safety net for the community. Community leaders like President Jimmy Carter, U.S. Congressman John Lewis, who secured the funding for West End's X-ray department, Assistant Surgeon General Dr. Marilyn Gatson, HRSA Administrator Elizabeth Dukes, former Lieutenant Governor Mark Taylor, and former Atlanta Mayor Shirley Franklin, amongst others, have supported the center and its outreach efforts. Throughout the years, West End Medical Centers has helped to elevate the community's expectations of health care and raise its standard of health awareness. It continues to build its history through assertive efforts to create a healthier community.
In this new decade, West End Medical Center is well positioned to continue to provide comprehensive primary health care to the citizens of our community. With the new reform initiatives, President 1 in 4 Georgians are without health care coverage. And even if health reform passes, there's an estimated at 2013, there are 51 million Americans who will still lack health insurance. And 5 years later, with health care reform, between 18 and 23 million Americans will still lack health care insurance. West End Medical Center is a safety net. We're here to provide comprehensive primary health care to the underinsured, uninsured, and the at-risk populations in our community.
In years to come, West End Medical Centers will continue to be a leader among community health centers. From being awarded by the state of Georgia as one of 5 community health centers in the state to partner behavioral health management with medical care, to being one of 3 organizations in Georgia that was funded by the Department of Health and Human Services, Center for Medicaid and Medicare Services, to enroll uninsured children in Georgia Peach Care for Kids and Medicaid programs, West End Medical Centers employs innovative strategies to reach those in the community who need them the most.
Again, I would say that health care is a right. And it doesn't matter how much money the person had or how little money the person had. The person has a right to quality health care. And I want every patient who walks in here to understand that they would never be denied care.
With our help, West End Medical Centers will remain steadfast in its plight to provide world-class health care near you.